Have you ever heard of a condition called achalasia? It's not exactly a household name, yet this rare disorder impacts the lives of those who suffer from it in a profound way. Achalasia is a unique condition that creates a roadblock in the pathway from our mouth to our stomach. It primarily targets the esophagus, the vital tube that transports our food and drink down into our digestive system. This condition tightens the esophagus, making it increasingly difficult for food and liquid to pass into the stomach. Despite the advances in modern medical science, the exact cause of achalasia remains a mystery. It's a rare disorder, with fewer than 1 in every 100,000 people diagnosed each year. However, its rarity doesn't diminish its significance. Now that we know what achalasia is, you might be curious about its symptoms. Stay tuned as we dive deeper into this intriguing condition in the next scene. So, how does one know if they have achalasia? Well, the symptoms can be quite a puzzle. The most common one is difficulty swallowing, known as dysphagia. It might start with solid foods but can progress to liquids as well. Another symptom is the regurgitation of food. This isn't your typical heartburn, but food coming up without any acid reflux. Then we have chest pain. This isn't your run-of-the-mill chest discomfort, it can be intense and can even mimic the pain of a heart attack. Some people with achalasia may also experience weight loss, which is often unexplained and can be quite drastic. Lastly, there's coughing, especially at night or when lying down. But here's the catch. These symptoms can be easily mistaken for other conditions like gastroesophageal reflux disease, making achalasia a bit tricky to diagnose. It's like a chameleon in the world of medical conditions. With such elusive symptoms, how do doctors diagnose this condition? Diagnosing achalasia can be a challenge, but it's not impossible with modern medical techniques. To identify this rare disorder, doctors often rely on esophageal manometry, a diagnostic procedure that measures the pressure and coordination of muscle contractions in your esophagus. Other techniques include the barium swallow test, where you swallow a liquid that coats your esophagus and shows up on X-rays, and endoscopy, a process allowing a closer look at your esophagus using a thin tube with a light and camera. Once diagnosed, treatment options vary. Medications can be used to relax the lower esophageal sphincter, while Botox injections can temporarily paralyze the muscles. Pneumatic dilation or stretching of the esophagus and surgery are other options for more severe cases. Remember, while there's no cure for achalasia, these treatments can help manage the symptoms and improve quality of life. Achalasia might be a rare condition, but with awareness and proper medical care, it's manageable. Knowledge is the first step towards empowerment.